Hi, I'm Dr. Simon, right from my clinical neurophysiology clinic. Today I want to talk about stroke, how you can have a better stroke post-recovery. Most of the people, most of the scientists and the doctors in the world, they are focusing on early diagnosis of stroke. That is fine. But even if you do the early diagnosis of stroke, what actually you can do because stroke already happened. And in that cases, we need to understand the basic pathophysiology of stroke and how our brain cell damage so that we understand how we can improve the condition after the stroke so that the brain cell regenerates and we have the better stroke recovery without significant disability. Before going into the post-stroke recovery, it is very important to understand the pathophysiology of a stroke. And in this animated video, it explains very well what is the pathophysiology of a stroke.
A stroke occurs when there is an interruption in the blood supply to the brain. When a stroke occurs, some brains are temporarily starved of oxygen, causing them to swell and stop working properly. This is why the effects of stroke are worse at the beginning. After a few days, when the swelling starts to go down, some cells recover, but others may not. Even then, other parts of the brain can be encouraged to take over. Ischemic stroke. This happens when a clot blocks an artery that carries blood to the brain. It may be caused by a blood clot which has formed in the main artery to the brain, a blockage caused by a blood clot, air bubble or fatty lump forms in a blood vessel somewhere in the body and is carried in the bloodstream to the brain, a blockage in the tiny blood vessels in the brain. Hemorrhagic stroke. This happens when there is a rupture of a blood vessel in the brain. It may be caused by a blood vessel which bursts inside the brain, a blood vessel which bursts on the surface of the brain and bleeds into the area between the brain and the skull. It is important to understand that no two people are affected by stroke in the same way. Some people have only mild effects which improve in a short time. Others may suffer more serious and long-term effects. The effect of a stroke on a person depends on which part of the brain has been affected and how much damage has been caused. The brain has two sides, hemispheres. The messages, nerve signals, cross over at the base of the brain.
After a stroke, the treatment modality is focused on the prevention of a second stroke, which is fine, but it doesn't really take care of the present damage other than the physiotherapy. Physiotherapy is very important and we need to must continue the physiotherapy in a stroke patient. However, it's not enough to improve the area of damaged brain cells. The food and nutrition it takes a significant role in here. All the lifestyle modification we give the advice for prevention of secondary stroke or second stroke is not enough to improve the present damage in the brain. So the missing link is the omega-3. What we need to understand that omega-3 is a vital component of our brain cells. Even in adult brain, at least 30% of the brain cells are composed of omega-3. It means the DHA. However, most important part we need to understand in this context that DHA component is higher in the area of the cells where the metabolism is high. It's not only the brain, in the whole body. And our brain is the major organ who takes the highest amount of energy. Although the brain is only 2.3% of our whole body weight, 23% of whole energy of the body is utilized by the brain, and in children it is 74%. So can you imagine how important it is? And research shows that any place, especially in the brain where the energy intake is higher, the DHA concentration is higher. So it is very simple. If we give the raw material of our brain cells, so there is a chance the body will try to figure it out how to create the new cells. It was not so long that we thought that the adult brain cannot regenerate, but science has proven our brain cell can regenerate, although it's in a very small amount, but it can. Okay, the rate is slow, but it regenerates. The main focus of this whole educational video I'm sharing with you is to make you understand the importance of omega-3 in post-stroke recovery. To make it more strong, so that your belief is more strong on omega-3, let me share with you a useful and very amazing story. Please Google this article. You will find out this boy whose name is Bobby. He was 17 years old and suffered a very severe road traffic accident and severe brain damage, almost clinical death, and he had multiple organ and body injury as well. His mother was a nutritionist, and what happened actually, the treating physicians, the neurologist, neurosurgeon, they said there's no hope. Even if he can regain his consciousness, he will be totally vegetative state. Mother did not lose hope. She tried to find out some other doctors and met another neurologist of a different hospital, and they tried fish oil, means omega-3, and the dose they're giving is amazing. It's not that one or two capsules usually we doctors recommended. He was given omega-3 almost 20 gram per day, and surprisingly he woke up from the coma, and now this boy is actually moving around, walking around just like another normal person. How amazing it is. If you want to know more about omega-3 effect, I highly recommend you to read this book called Omega-3 Effect by two famous doctor, William Shears and James Shears. They have vast experience on research on omega-3. In this book, you will be able to understand the right doses of omega-3 in different conditions or even in the normal daily life. Because the recommended dose by the doctors at present is 1 to 3 capsule is not really effective. Where to find this book? I have attached a link at the end of this video. You can purchase the book from there. Now you can see that omega-3 really can do amazing things. It's not really miracle. Please be logical, understand that if we can give the raw material to our body for different cells, it will try to repair its damage by itself. So please don't forget about omega-3 in post-stroke recovery.